The Education Ministry has recently reported a concerning increase in HIV infections among young people in Malaysia. In 2023, 244 students aged 18 to 25 were diagnosed with HIV, marking a 31% rise from 2021. Now, this age group represented about 7% of all new HIV cases last year. We explore the factors driving this alarming trend with infectious disease expert Dr Khairil Erwan Khalid. According to Khairil, the reason is mainly due to the lack of awareness and the surrounding stigma and discrimination related to HIV.
We do know that HIV testing is widely available and accessible these days. It's probably the lack of awareness for those youth who are at risk of acquiring HIV infection. They just don't get themselves tested early, and they probably don't do regular testing, even though they are at risk, but they may not be aware about it. And that's one thing. The stigma around it as well, because I think some youth who are at risk of getting HIV infection would probably, they do not really want to come to healthcare facilities to get tested because of the stigma. So that would probably be one of the reasons why they come in late for testing. And also, I think the lack of comprehensive sex education, I must say, something would probably be like a sort of inadequate or sort of inconsistent sex education from young, because I think the secondary school syllabus, for instance, we probably just be talking purely about, the biology of, let's say, human anatomy or the sciences behind it, but we don't really talk about it in an open approach, talking about how what is safe sex, what are HIV preventive strategies, talking about unwanted pregnancies, that sort of things.
He called for more efforts into disseminating accurate information to the masses.
It has to be like a collaboration with all the stakeholders involved, mainly, for instance, Ministry of Health, Ministry of Higher Education, community-based organization. I think we should work hand in hand to sort of increase the outreach programs, increasing the awareness in the institution, perhaps engaging their peer counselors or the university counselors to sort of disseminate accurate information, talking about safe sex and also HIV prevention. It is also important, I think, if we can actually integrate the information about the importance of promoting regular HIV testing among youth who are at risk of acquiring HIV. It is associated with, taboo topics like sex education, using condoms, for instance, stuff like that. But again, it's something that we just have to do it, because if we do not talk about it sort of openly and giving accurate information, this group of people, this youth, would probably resort to, let's say, getting more information on social media, on the website. So it may not be accurate information, and that is going to be more detrimental